Going to move to focus more on in-service training. There is a multi-organizational effort right now to look at in-service framework in terms of effectiveness, efficiency, and sustainability. And we have two esteemed colleagues. Diana is a health system strengthening advisor with USAID, and her work focuses on human resources for health and quality improvement. She's a technical advisor on several USAID global projects. She's also a member of the PEPFAR Human Resource for Health Technical Working Group and the steering committee for the USG Evidence Summit on community and formal health system support to enhance CHW performance. So she's received her MPH from a prestigious university, Columbia, in New York. And we also have Tana. We also have Tana, who is a senior advisor for healthcare workforce development with the USAID Healthcare Improvement Project, HCI with URC, with expertise in health worker education and training, human resource for health planning, quality improvement, and access to medicine. She received a PhD from the University of London and a BPharm from the University of Otago. So she's working with the URC team, and she's also been involved with the Healthcare Workforce Development Unit, testing and looking at innovative applications and improvement science to improve health worker performance in a number of countries. So you have the floor.
Great, thank you. So we're actually going to tag team this presentation because this work was very much a multi-team effort, multi-organizational effort, and I'm delighted to be able to present this together with Diana. Go to the next slide. So just an overview of what we're going to be covering today. We're going to have a brief introduction. What is it that we're talking about? Why did we even go in this direction? What is inside the framework itself? How was it developed? And then how has it been used, and what are some ideas for its use? We would like for this to be as interactive as possible, and it's great to see the questions come up at the end, but we would love to have your input during the presentation. So who here has a cell phone? If you have your cell phones, actually take them out. Don't listen to the advice they give you in the movie theater. Take out your cell phone, and we have opportunities for you to give inputs, give ideas, give comments, and even vote on what you think are the most critical issues during the presentation. Before we get started with that, I'm going to ask Emily Lanford, who's a project coordinator at URC, just to give some instructions on how that's going to work.
Okay.
Thanks, Tana. So, as she mentioned, within this presentation, you're going to actually see a series of a few questions to which we're going to ask you to respond using the Poll Everywhere technology. There's a printout of instructions on each chair, and also as the questions come up on the individual slides, they'll be displayed there as well. But basically what you're going to do is for the first question, you're going to send a text message to the number 22333, which you should not have to repeat for the subsequent questions. If it's a multiple choice questions, there will then be a unique keyword which you can enter to correspond with the answer you wish to submit. If it's a more open-ended question, you'll also have a keyword, and then you'll need to put a space, and then you can just text in your response. And all these will be displayed in real time as they're being submitted. So I think I'll actually go to the back of the room, and then while the voting's taking place, if you have any questions or problems, you can just raise your hand, and I'll do my best to get to you. Thanks.
Okay, great. So as Emily was said, the number is 22333, and so that's the number you're going to text your responses to every time. Okay. And when we come up with the questions, we'll give you forewarning so you kind of think about what you want to say. And it's fully transparent, so it's all going to be displayed. So bear that in mind when you submit your responses, but we won't know who did it. Okay. All right. So we're going to get started without much ado. Go ahead.
Great. Thanks, Tana. So first, what is the in-service training improvement framework? And the framework is a set of practice recommendations to improve in-service training effectiveness, efficiency, and sustainability that were developed and agreed upon through international expert consensus. Now I'm going to ask that everyone start to think about what makes in-service training effective, efficient, and sustainable, because we're going to be asking you for your input very shortly. A little bit on the global landscape of in-service training. First, in-service training continues to make up a large proportion of country HRH investments made by both Ministries of Health and development partners. In-service training is needed for the scale-up of health services, for example, with HIV, TB, and maternal and child health. And scale-up would not be possible without building the capacity of our existing workforces. Also, there's a growing attention of countries in reviewing their current in-service training portfolios. Countries are increasingly concerned about issues related to limited or inadequate training evaluations, duplication of training, poor coordination and quality, fragmented training systems, and really the current guidance for in-service training is very fragmented across multiple sources and is very incomplete. So there's really a need for evidence-based guidance for how we can improve in-service training at the program and system level. So how can we ensure that we are achieving the greatest gains in these investments that we're making in in-service training? And how can we improve the effectiveness, efficiency, and sustainability of in-service training? Now, when we say effectiveness, what do we mean? We mean training outcomes at all levels. Efficiency in training processes, reducing waste and improving cost effectiveness, and sustainability, how we're supporting in-country institutional capacity building and building national systems for continuing education. So before we talk about how we tackled these challenging questions, we want to get your opinion on what the key outstanding issues are and challenges affecting the effectiveness, efficiency, and sustainability of in-service training. So this is our first Poll Everywhere question. So it's an open-ended response. So you're going to text your response to 22333, and you have to insert the keyword 592835, space, and then your answer. And fingers crossed this works. Got our first response. It's a good sign. And a couple more. Okay, so far we have effective implementation and stakeholder buy-in, government commitment and leadership, all aspects of the in-service training, education, funding, and quality of training. And this is a good sign because these are some of the similar issues that we came up with when we started this project too. So some, just to cap on some other issues that we came up with when we started this activity: effectiveness, what affects effectiveness, it being needs-based, stakeholder engagement, making sure that there's coordination, what type of feedback or mentoring or support is provided; for efficiency, how training is designed, what is the selection process used; and sustainability, are we building capacity of local stakeholders, are we working within national policies and building local ownership. And you can see that a lot of these issues are very interrelated to one another, so they're not very separate. So now Tana is going to discuss the process that we use to develop the framework and answering this difficult question.
Okay. All right. I don't know that you can see me, so I'm going to stand to the side. Okay. This often happens. For some reason, I don't grow between presentations. Very frustrating. Okay. So coming to the content, what is inside this framework and how did we develop it? Diana mentioned that this was an expert-led process, and this, as I said at the very beginning, this was very multi-institutional. And we have a number of organizations represented here who are actually part of the process. And I would like for the members who were involved just to briefly stand so that they can see who was involved, because this is very much something that you all developed. So Lois, I see you hiding in the back, Julia, Diana, yes, folks from IntraHealth, MSH. So it was a real, thank you so much. It was a real multi-institutional effort. And the reason for that was that so many different organizations have different types of expertise and experience. And when we looked at the literature in this area, we could see that there are a lot of, although there are a lot of studies, as Alex rightly pointed out, there are not always a lot of studies about some of the broader in-service training systems issues. And this is where the experience and expertise of different stakeholders becomes so critical. So what we first did was brought together a consensus group that was made up of 25 members of implementing partners, donors, professional associations, and other independent experts to really come together and share what the experiences are. They formed a group which we led through a Delphi process. And the process was very much this. First, to understand what kind of practices do lead to better in-service training in terms of its effectiveness, efficiency, sustainability. We developed and revised recommendations. We worked with them to consolidate those. We then looked at those, categorized them, and codified them, and then embarked on targeted literature reviews to say that, well, this is what the experts are saying. What do we know from the literature about this particular category of recommendations? We then fed that back to the group, we rated our level of agreement on the recommendations, and on we went, round and round we go. So as I mentioned, we employed a modified Delphi process. We had 5 rounds of the process, and the goal was to bring into the framework recommendations that achieved consensus throughout all of the rounds. And so by the 5th round, we were able to extract those recommendations that were able to survive, I guess, all those rounds and really be able to reach consensus across the group. And the first round, as Dinah was mentioning, we raised the question, what kind of practices lead to more effective, efficient, and sustainable in-service training? And in the first round, we had 75 recommendations that were generated. We were able to consolidate some of those and feed them back into a second round and ask the consensus group members to rate their level of agreement with that recommendation, provide suggestions of experiences or evidence or examples that they were familiar with that would support that recommendations, as well as suggest any revisions that they might like to see. As we worked through our rounds, we got to a point as a group where we decided that we really needed to bring other external stakeholders on board across the world. And so we actually issued a call for an open round, and we had that held about this time last year, actually, and it was held online. We had involvement from 26 different countries, over 86 complete responses to that round, and we had individuals from other countries go through a similar process. So they would look at every single recommendation, look at a brief summary of the evidence that accompany that recommendation, and then would also rate their level of agreement and give other examples or suggest other references that we could look into. As you can see, we were able to get pretty high level of consensus. So 44 out of 48 recommendations reached consensus. And by the way, we're defining consensus as 90% or above in agreement. And then we use that input to then have a 5th and final round with just the consensus group members. And this was held in Washington, D.C. with remote participation from some members who could not join us. And at the end of the day, we reached consensus on 40 recommendations. And it's these 40 recommendations that form the improvement framework itself. So this improvement framework at the moment is a set of recommendations that have the consensus of the experts, but what we would like to do to really make this framework operational is to accompany it with some how-to guidance. So for each recommendation to have a brief compilation of existing evidence, examples, and also links to resources. Prior to coming into this activity, we knew that several groups had been working for a number of years and producing excellent guidance for in-service training, and we wanted to be able to link these various resources and tools together. So this could be a living how-to guidance. The recommendations themselves are written in such a way that we didn't want them to be we wanted them to have a sort of a lifespan to them. So we didn't want them to be too tied to anything that was particularly fashionable at this point in time, but something that could be a living document and continue to shape and develop over time. We expect to launch this in the next quarter, hopefully early 2013, so watch this space. In terms of the content itself, we were able to organize these 40 recommendations into 6 major themes, which you see presented here. And I'm going to give you a heads up that I would like to have your input in just a few moments about which of these you think are the most challenging to address, and perhaps in the Q&A session we can discuss some of the reasons why that might be and how we could overcome those challenges. We'd love to have your input on that. So what kind of content do we see in each of these themes? And I'm just going to go through each of these, and I'm not going to, you'll be relieved to know that I'm not going to rattle off all 40 recommendations. I'm sure you would love to hear that. But I'm going to deny you that, and instead I'm going to just highlight some of the key messages for each of those themes. And feel free, if you want to probe into each of these in the Q&A, I'd be happy to do that. So for the first theme on strengthening training institutions and systems, this was really about the in-service training system at a systems level. And in some countries, it might be the continuing professional development system that Kathleen alluded to, or the continuing education system. But we saw it important that training was not just a once-off here and there, but it really fit into a broader system that had national leadership, that had the engagement of key stakeholders, including regulatory and professional bodies, and that was also including an explicit strategy to build capacity and strengthen local infrastructure and trainers to provide that training. We observed in many countries, and the input from participants in different countries was that training was often led by particular groups that were external to the local organizations, and this was seen as a real threat to sustainability and as a trend that does need to shift. It's not an easy one. The support of continuing professional development systems, it's an emerging area. Many low-income countries now have mandates to have compulsory continuing professional development for certain cadres of health workers, and this is something we're going to see continue to grow. And so for us as a training community, it's a trend that we need to look at how we can support and in what ways we can ensure sustainable systems development in that area. The second theme around coordination of training. As Diana mentioned, in-service training right now is forming a huge proportion of the current investments into human resources for health, and that is unlikely to change. If that is the case, how can we better coordinate in-service training so that we can minimize duplication? Diana's going to explain an application of this framework we did in Ethiopia, but we did observe that there were a number of opportunities for reduced duplication, but in many times those coordination mechanisms do not exist. Some of those are being set up by some projects in some countries, which is wonderful to see, and we certainly as a community would like to encourage that. The other form of coordination is really with the work sites of where the trainers come from themselves. We see that disruption to health services due to training is an unintended effect of training, and this is something that we need to look at. The evidence is also showing that more immersive, situated, small piece distributed learning can also be more effective, and modalities such as these should really be taken advantage of. Often we're not seeing that being put in practice for various reasons. Tracking mechanisms is going to be a really important part of this. A lot of this can't be operationalized until it's known exactly who's doing what training, where and how and why. The third theme is about that continuum from pre-service to in-service. In-service training doesn't sit in a vacuum. It has to be linked to whatever is happening at the pre-service level, but we've all observed instances where the content and the approaches are inconsistent between pre-service and in-service. And it's wonderful to see examples, and we do have those examples in the guidance that's going to come out, of how people have actually been able to synergize between pre-service and in-service. And again, there's not a lot of evidence in this area, but we'd love to see more work done here. The design and delivery of training is where the bulk of the evidence lies, and you're going to hear a lot more about that from Julia, so I'm not going to go into that in depth. But essentially, first and foremost, as Alex was saying, is the training needed? Is the training the right intervention for the need, for the performance gap that we're observing? And if so, is it aligned with the plans? Do we understand what other performance barriers are there? And are we coupling that with other types of interventions which may ultimately address that performance gap? And are we seeing compliance with policies, strategies, and laws? We had a lot of back and forth discussion with the consensus group where we felt somewhat conflicted about this recommendation, because at times in-service training is bringing in a new service or a new type of intervention which may not even be in the legal framework. It may not be in the legal scope of work of a health worker. But we all did agree that if that was the case, there's still a way in which formal agreement could be sought with the governments that this concerns to make sure that we're still operating within national laws and policies. Evidence-based methodologies is a given. Support for learning was another theme in the framework, and really highlighting the opportunity to better share existing resources and materials. There's such a plethora of training materials and resources that have been developed. And I think there's always this temptation to reinvent new materials every time, whereas we could really learn a lot from each other and build up communities of practice, both locally, regionally, and also internationally, that we could share our resources and materials and conserve our efforts in this area. Supporting trainees post-training was not something that we had a lot of very good examples of, but we all recognize the importance of. And again, something that is not always covered in many trainings, but is actually this concept of lifelong learning, self-directed lifelong learning. And do learners get support to build those self-directed learning skills so that they themselves can look into resources, references, and so on, and be able to update themselves rather than relying on an external group to do that for them. And finally, evaluation and improvement of training. And I especially want to acknowledge ITEC. I don't know if there are any ITEC colleagues here, but they're working on a framework, which is actually a process almost concurrent to ours over time. But they've been developing this framework that really tries to codify different methods and approaches to evaluating training. And that's available online. We have a link to it in our how-to guidance. But really advocating for building in evaluation to inform continuous improvement of in-service training. We could see that evaluation is not always part of training, especially training that's considered fairly routine. But even if it is routine training, I think it's even more of a case for having evaluation built in, because there's so many opportunities to continuously improve that training. And also the issue of evaluation against defined criteria, and the criteria being set together with different stakeholders, particularly in-country stakeholders of the trainees and the work sites and the ministries, etc., that are involved, and really engaging them in the process. So these are some of the highlights of the types of recommendations we see. What are you going to see in the how-to guidance? This is an example of one of the recommendations that actually Japaga was helping us out with in the theme of design and delivery of training. So you'll see the recommendation itself. There'll be an explanatory note about what does that recommendation mean, why is that recommendation there, what do we know about this recommendation from the evidence and experience, and also there'll be a section that gives practical examples of how that recommendation's been put into practice that people can read into for more information, as well as additional resources that already exist that we don't need to develop anew, but rather resources that people may not be aware of or can be linked to. And we're aiming to develop these brief one-pages for every single recommendation and put that and package that together into a how-to guidance. So here's your chance to give your input. So out of the 6 themes that I mentioned to you, which of these do you think are the most challenging? And we'll pick up on this conversation in the Q&A to really understand those challenges a bit more and how we could overcome them. So again, the number you text it to was 22333, and you're going to put the code. There's different codes for different options. So pick the code for the option that you would like to vote for, and we'll start to see the results on here live as those votes come in. Well, that's an N of 1. So okay. Just going to give you another minute because I see some more people busy texting away. Okay, well, it looks like the first, it's an N of 15, but the first one, strengthening training institutions and systems, is a number of people are are voting for that. And certainly, I think as we were looking at it as an expert consensus group, we felt very similarly. And I think trying to unpack some of those challenges a bit further, understanding how we can better document our experiences and interventions to strengthen in-service training systems is going to be key. And we look forward to discussing that in the Q&A. Okay, well, they're going to keep coming in. We can flick back to the slide when we get to the Q&A as well, because the results will update. Okay, I'm going to pass it over to Diana now to conclude with some experiences around how this framework has been applied already, even though it hasn't been published, but there's been a lot of interest from different groups in applying it.
Great, so we have several country experiences for how this framework has been utilized thus far, which is very exciting. As Tana noted, it's not yet finalized. The first is in Nigeria. As I mentioned before, many countries are wanting to review their in-service training portfolios, and this is true of the PEPFAR Nigeria team. And so Capacity Plus, IntraHealth, helped use our framework to develop an assessment tool and then carried out an assessment of the PEPFAR Nigeria in-service training portfolio. In Afghanistan, with the support of JPIGO, the framework informed the Organization of National Training Standards for the Afghanistan General Directorate of Human Resources in-Service Training Department. And in Ethiopia, which I'm going to expand on a little bit in the rest of my presentation, we had the opportunity to work with our USG colleagues in an effort that they're currently working with in supporting the Federal Ministry of Health in institutionalizing and harmonizing their in-service training. And so we used the framework to develop a rapid assessment tool and then carried out a rapid assessment to inform the Federal Ministry of Health efforts. So in Ethiopia, how did we go about using the framework to develop the assessment tool and conduct the assessment? First, in Ethiopia, there's currently a technical working group formed that's looking specifically at in-service training and how they can support the Federal Ministry of Health efforts. The technical working group is composed of members from the Federal Ministry of Health, regional health bureaus, professional associations, partners, and donors. And so working with the TWG, we helped identify what the objectives of the assessment would be. And then utilizing the framework, we then identified specific themes within the framework that would be key themes of the assessment. So for developing the assessment tool, we took specific recommendations from the framework and turned them into survey questions. And then we took recommendations from the framework and developed 10 practice scenarios that would be used for key informant interview questions. And then the survey was sent to 62 in-service training providers, and it was not limited to HIV training, and expanded all types of service delivery training that is currently being offered in Ethiopia. And then with the help of the Federal Ministry of Health, we identified 20 persons to conduct key informant interviews with. And so it was a rapid assessment. It took place within about 2 weeks. And at the end of 2 weeks, we were able to get surveys completed from 55% of the eligible in-service training program providers, so 34 of the 62. We were able to complete the 20 key informant interviews. And it's interesting that the data that we collected represented over 27,000 training encounters that were held between January and December of 2011. And so what did the assessment result in? We have a much better picture of the current national in-service training situation. At the time before the assessment, the technical working group didn't really have a good understanding and a clear picture of what was actually going on in the ground. We know a lot about the different in-service training program provider practices that are being offered, specifically around how in-service training is being designed, how it's being delivered, how it's being evaluated, how program providers are linking with health facilities, how they're identifying learning needs and the participants, and how they're tracking the training. And we are also able to obtain key stakeholder opinions on in-service training priorities, issues in strategic development, on issues related to coordination, licensing and regular renewal of licenses, continuing professional development systems, accreditation of in-service training materials, and what they thought their opportunities and priorities for in-service training should be in Ethiopia. So then we were able to present the results at a National In-Service Training Strategy Consultative Workshop that was held in August. And we had 35 participants attend that represented key stakeholder groups from the Federal Ministry of Health, the different regional health bureaus, training institutions, professional associations, and all the development partners and donors. And over 2.5 days, our objective was to develop and reach consensus on a draft strategic framework to inform a national in-service training strategy. And during this time frame, participants were able to utilize the assessment results along with their expertise, and through participatory and structured group processes, they were able to develop the strategic framework. So what was the strategic framework? So first, we, as a group, identified what the priority issues for in-service training in Ethiopia should be, and we ranked these priority issues. And for each priority issue, we developed strategic objectives for each of these priority issues. And the strategies and inputs that we could take for reaching the strategic objectives, what the identified opportunities and barriers to reaching these strategic objectives, and then the different stakeholders and their roles for helping to reach these objectives. And at the end, we were able to reach consensus on 14 strategic objectives. The first was to develop a national in-service training framework. And so how does this different from the framework that we utilized to conduct the assessment? This framework kind of outlines what the strategy should be for Ethiopia. And at the time after the workshop, it still hadn't been endorsed by the Federal Ministry of Health, so it was the idea of all the participants that this framework would be endorsed and that they could use it to develop their strategy in moving forward. The second priority strategic objective was to institutionalize in-service training. There was definitely more buy-in for the Federal Ministry of Health efforts in wanting to institutionalize and harmonize, and it was nice that we had so many stakeholders at the workshop from across so many different players that are involved in in-service training coming together and really strategizing the best way to move forward. And the third, they agreed upon the importance of developing annual in-service training plans at the national and Warita health facility levels, something that hadn't been done to date. And so at the end of the workshop, the result was that we had a national strategic framework that would help guide all Ethiopian stakeholders towards improving in-service training in Ethiopia. So now we're going to ask you, you've heard a little bit about how we've thus far utilized the framework, and we'd like to get your input on how you think we could utilize the framework moving forward. And so, again, text 22333, the keyword is 347984, and then you have to have a space before your response. I think this question requires longer responses, so. Great, so we have some responses. Some ideas: better accountability and awareness of in-service training, the need for creating indicators for evaluating in-service training systems in a particular country, making a framework simple enough to be utilized in various settings. It can provide common language across country groups and guide country leaders in preparing in-service training systems and using for developing implementation guidance. So these are all great suggestions. And then we have a couple just to summarize. We envision utilizing the framework to inform the development of in-service training standards or quality criteria, informing the development of in-service training assessments, guiding the development of indicators that was mentioned in the question response, guide the development of activities to improve in-service training, and then the use of the framework as advocacy for policy changes at the country level. And so we want to end it with some take-home messages. We feel that this activity has been a great multi-stakeholder process and is an effective way of engaging expertise to build consensus on in-service training and how it can improve in-service training globally and at the national level. And really, I think the experience of Ethiopia really speaks to how the framework can be used to bring together country-level stakeholders around a shared vision of in-service training. And we want to acknowledge everyone who has been with us through this process. It's going on its third year, and we appreciate everyone's support and being on the ride with us. And that's it.
Thank you.
Very difficult in an area where we don't have staff. And then sending the same staff you're having for in-service training. If I'm actually an administrator, I may actually be stopped from sending staff to go for any in-service training. So did you actually encounter that when you're actually doing this research? And what was actually your solution to that? And because I can see some people in Africa, in the low-income countries, they prefer to have the on-site continuous monitoring training. So where they actually monitor staff on a continuous process. They don't actually let their staff go for any central training. So they prefer to have their staff trained on site, where we have someone going there, sitting with them. I didn't want to ask this question to the first presenter, because I did assume that mentoring was actually like supervision, but probably you could also probably confirm if I'm wrong, if mentoring, on-site mentoring can actually be also part of your review as you do your research. Thank you.
Okay. Yeah, I think that's a really great question. I think it's a challenge that many countries and work sites are facing. So when we look at in-service training, we're looking at very diverse types of trainings and also diverse modalities being used. And one thing that the experts and also the literature was clear on is that where possible, on-site supported learning that would enable better transfer of learning is preferable. Now that is not always possible, but that is something we've certainly been advocating for in the framework itself, and I think you'll find that the literature also speaks to the same. Do you want to add?
Sure, and I would just say another issue that came up a lot was the actual process used to select participants and how often many of the trainees attend lots of different training and are taken away from their sites. And so how we can better instill practices for the actual selection and the timing of the training to minimize the disruption of services at the facility level.
Any other question? Okay, I'm going to ask you to stand up, everybody.
Stretch.
It's been almost 2 hours. Okay. Okay. Okay.
Sure.
Yes.
You want to answer that?
Yes.
Yeah.
Before we move to Juliet, Alex wants to just answer the question on mentoring.
Yeah, so
I'm not sure about mentoring per se, but in
You can sit back.
But in the section of the review where we code attributes of training, one of them is whether the training is on-site or off-site. So that gets a little bit to the questioner's point.
Okay.
And I didn't include it in the results that I presented simply because I ran out of time, but it's in there.
Okay, thank you. We are going to thank you, Diana and Tana. You want to say something?
Yes,
Okay, go ahead.
If I could fulfill
Go ahead.
a promise I made during the presentation, was just to revisit the responses to this question here about which of these themes, which of these areas are most challenging to address. And by and large, you can see that the strengthening training institutions and systems came out the most. And I think a lot of the emphasis now, especially of AID and others, is really capacity building and how can you strengthen systems. And we recognize that this is a major challenge. And I would love to hear comments or suggestions or any experiences from people in the audience here around what they feel to be important, how they think the challenges can be overcome, or what they would like us to consider as we're putting together guidance for this particular area. Go ahead.
Go
Yeah.
ahead.
Kate Delenko from Capacity Plus. And as far as strengthening institutions, I think there's been a lot of focus on the professors and the curricula, and what we think is very important, and we've been working on, is the management of the school. There's so much more to a school than the curricula and the professors. There's a lot of moving parts. Nursing, medical schools are very complicated institutions, and often they're quite poorly run. And that's one thing that we've been looking at.
Great. So managing schools. Any others? Yeah, go ahead.
This goes a little bit towards what you just said and also ties in the pre-service, in-service, and this institution and capacity. As a medical doctor, my way of practicing was really developed during my medical training. And it's very difficult to change practice afterwards. We were trying to see in PMI how the pre-service training changes as new guidelines come out, because of course they come out very frequently. And when we were trying to figure this out, we found in the countries we were looking that it was very, very difficult to find out what different institutions are doing and how they update, or if they update their curriculum in a timely manner because of a fragmentation between the schools and different methods or lack of methods to update those curriculum. So I don't know, you may know, but we were not able to find out if the updated guidelines were rapidly included into curriculum.
Yeah, that's an important element. Okay, great. Well, when we do publish this how-to guidance, we again want to invite the broader community to give input. So we'd like to publish it in a format where people can comment, add additional resources that we may have missed out, links and so on to references that are key. So we very much see this as a community effort and would love to invite you to continue to be part of this, this growing movement towards better in-service training that's more effective, efficient, and sustainable. And I also want to mention something that we're working on within the group, particularly with JPIGO and Capacity Plus, is an in-service training journal series in the Human Resource for Health Journal, which is currently in process. There's going to be a paper about the framework itself, as well as some published works from JPIGO and also Capacity Plus and the HCI project, sharing experiences around in-service training. So just to alert you that that's going to come up early next year as well. Thank you.
Yeah. Thank you, Diana and Tana. I think it's great to see that partnership between various organizations.